Setting out the stalls is second nature, but for the traders of Castleford Market, it's the first time in 10 weeks they've been allowed to. It's back to business, though not as usual.
Being locked in and everything like that, it's been really downhearted. You know, I feel depressed and things like that, but to see this now getting back to normal, I think it's great.
Well, they won't pick you funny, you strong.
The prices are still in pounds and ounces, but 2 metric metres is the social distance. Masks and gloves reinforcing the post-lockdown reality.
I feel awful, I can't give you the cuddle. We will one day, soon, hopefully.
Cases of coronavirus are falling across the UK, so too are deaths. The government is confident it's time to lift key elements of lockdown and even let people most vulnerable to severe disease, those shielding, leave their homes to socialise at a distance.
I'm a diabetic. I'm one of the at-risk people. So this is my first day out, so I'm very apprehensive about the whole thing.
And perhaps he should be. The government has repeatedly said new cases of COVID will be closely monitored as lockdown is eased. Its test and trace programme supported by an alert system prompting local lockdowns if new hotspots emerge. But today we learned the body underpinning that, the Joint Biosecurity Centre, isn't even established yet. I just wondered if you could update us on the Joint Biosecurity Centre.
Yes, we're getting it stood up, making sure that all of the information flows come to it so it's able to analyse them and to make sure that it gets set up correctly. That's all that work's being done as we speak.
But it doesn't exist yet?
Well, it's being formulated at the moment. It's being pulled together, yeah.
It's really concerning that this biosecurity centre isn't up and running effectively, because what it tells us is the government announced the launch of test and tracing far too soon. Last Thursday, we heard from the Prime Minister and the Health Secretary. Today, we heard from the Business Secretary that testing and tracing is up and running. The reality on the ground is very different from that.
In 2 weeks, the next phase of easing lockdown is expected, the reopening of non-essential retailers. But if we still don't have the tools to measure how the outbreak responds to today's lockdown changes, are these steps too far, too soon?